Hi, thank you so much, Sue. It's so really wonderful tonight to be here with my colleagues, Sherilyn and Sarah, and we're really excited to share the work we've been doing in midwifery education, especially the work over the last 12 years since we updated our curriculum, really. So we wanted to really talk about how we are working hard, even through the challenges of COVID over this last year of the nurse and the midwife, to create coherence for students on our programme by offering person-centred midwifery curricula. And we work really hard to transform and progress education so that we can transform outcomes for women, birthing people and families. And we try where we can to engage in creativity and use our passion for midwifery and for women and families in everything that we do as a team. So it's really special to be here together. So the focus of this presentation, we're all going to take a section each. So there's 3 main sections. And we think because in the UK, especially at the moment, we are all tasked with developing our curricula to meet the new future midwife standards. And so we're hoping that the things that we share tonight will be really meaningful and useful for other educators. But like you said, Sue, for students and helping students to engage in the curriculum that they're involved with. So we're going to break the sessions down into a background that I'll be sharing, the background to our current curriculum, our case-based learning curriculum. And then I'll hand over to Sherilyn, and she's going to talk to you how we designed and implementing and continue to implement that curriculum, and certainly how we're going to use it to meet the new future midwife standards. And then Sarah's going to talk about the impact that has as a student, but then also as you go out into clinical practice and beyond. So we hope that you enjoy hearing about what we've been doing with our education programme. So when we had to revalidate our programme every 5 years, midwifery programmes in the UK will revalidate, and there's an internal programme of revalidation with the university, but then the external validation that comes from the Nursing and Midwifery Council. And we've actually been waiting quite a while to revalidate since our last validation that was in 2012, because we've been waiting for the brilliant new future midwife standards. So we're really excited to be able to update our programme of study. But at the time when we wanted to develop the programme, we actually brought together a really big stakeholder group of people that was made up of students, of course, women and families, clinicians and lead midwives, as well as mentors, supervisors, assessors, and researchers and the educators came together, and we really started the curriculum development in 2011-12, focusing on what do we want the future midwife to be. So what will the characteristics of that midwife be, and how do we need to direct what we do with students so that they can be there and offer fantastic care for women and families. So that's where we started with the outcome of and it's really great to see that the future midwife standards are very outcome focused as well. So we feel really glad that that was the way that we approached our curriculum. We also focused around what we'd learnt from delivering education for years to students at the University of Central Lancashire. We wanted to look back and we wanted to ask. And so we invited students to feed into us and give us information about what they wanted from their learning journey. And you can see here that the students definitely wanted more tutor support, pastoral support. They wanted a better degree of flexibility on the programme, because midwifery programmes generally are full-time programmes of study. They wanted less PowerPoint, an increased holistic approach, more time for reflection and more group work. And most importantly, we wanted to avoid as educators, people sitting in front of us disengaged. Hopefully not asleep, never asleep, but that sense of how long can you actually stay engaged in the old-fashioned, more traditional lectures like that you were talking about, Sue, earlier. And we came together with our researchers. We're so fortunate at UCLAN that we work really closely with Professor Fiona Dykes, who led the maternal and infant nutrition and nurture unit, but also Professor Sue Down, who runs the research into children and health and childbirth health. Basically, they have always developed their research around the concept of salutogenesis, which is about well-being orientation and the origin of health. And it actually comes from medical sociologist Aaron Antonovsky. You can see him there with his pipe. And he said that basically he was interested in understanding not just the origin of disease, pathogenesis, which often frames a lot of medical training. He was interested in understanding what creates health and well-being, which is a slightly different question. So what generates well-being, the origin of health? And he saw that our health is along a continuum between disease on one end to healthies on the other. And we want to work really hard as educators and as midwives to generate well-being and move women as far as they can towards the healthies continuum. So what we were feeling at the time when we developed our curriculum was that actually we tend to label women in our care in relation to their condition. So you might say, oh, well, I'm looking after the diabetic woman in room 2, or the teenager in room 3, or the twin lady, I've got the twin lady in room 4. And we can label women in relation to their pathogenic orientation. And we wanted to try and move away from that in our approach to education. So we wanted to centre women in the context of their whole life continuum. So we know that women aren't just presenting with diabetes. They're also a woman, a mother, a family member. They've got busy home lives, working lives, and have a lot around them that will also impact on their well-being. So we wanted to develop a curriculum that was based on this idea of caring for the whole woman and her family, including her environment and life, and helping women and families to strengthen their sense of coherence. And this fits with Aaron Antonovsky's work around salutogenesis, that to generate well-being, we have to work at supporting people's sense of coherence. So just understanding what we mean by sense of coherence, he split this down into 3 components that help you to generate health and well-being. If you understand your life, if your life's understandable, comprehensibility, if your life's manageable, if you can manage what's happening to you and you have the tools and resources to manage it, and if most importantly, if your life is meaningful and the things that are happening to you are meaningful, then you will feel well. And what we recognised as an education team is not only is this a really good tool to help structure the learning for students and how they care for women and families, but we started to think this is great for us to think about how we support students. Because obviously as a midwifery educator, when you come into education from practice, actually, you're replacing the women and families that you've cared for clinically with caring for people, students, student midwives, future midwives through their gestation of learning. And so it was really important to us to make all of our curriculum comprehensible, manageable, but most importantly, meaningful. So we've used it in a dual way to support students' learning and knowledge development and skills, but also the way that we care for them. So all of this helped us to narrow down. We looked for different curriculum models and designs, and using that vision of salutogenesis and that underpinning philosophy helped us to identify an inquiry-based approach to our curriculum. So case-based learning is something that we identified. It had been used in other areas for some of the modules, like at Hertfordshire University, they used it for one module within the whole programme, but we decided to implement it for the whole programme because we felt that case-based learning offers a holistic review of real cases, helping students to meet women and families right from the beginning of their journey, even theoretically. It helps to consider the woman-family experiences as connected, and the group work, the small group work that Sharon will talk to you about, mirrors practice and working in practice. So it helps students to develop employability skills, active and deep learning. It really encouraged social learning in groups and together, which creates this sense of community and belonging that's really supportive for students. It also helps to respect students' prior learning. A lot of our students come from previous careers and the non-standard applicants. So we felt this was a really great fit. So I'm going to pass over now to Sherilyn so she can talk to you about how we've designed and implemented case-based learning.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.